Hello, Assalamu alaikum. So this is the journal sergeant here today, and we will discuss about many things in the coming videos. But today we will discuss about the dysphagia, mainly the history taking of the dysphagia. So this video is basically is for the students of the medical schools who are in their third year, fourth year, or final year of their medical school. Most of the time when they go to the ward and when their clinical start, so when their teacher asks them to take history of the patient who is coming with difficulty in swallowing, so they ask silly questions sometimes. So we will discuss about the dysphagia today, and how to take history from the dysphagia patient, and so this is how to take history from dysphagia patient. Okay, first you should introduce yourself, like, hi, I'm Dr. Michael, and I'm doing practice over here, and today we will I would like to ask some question. So if you are comfortable, so we may start now. So first thing is introduce yourself and be gentle with the patient at the time. Then the second thing, you have to take consent from the patient, like I mentioned before, I would like to ask some question regarding your disease. So are you comfortable and with me, and then you will start the history after consent. Ask about the biodata of the patient. Okay, like what's the name of the patient, age of the patient, address of the patient, from which city he or she is coming, or from which community. So then the marital status, occupation of the patient, and that's it. If the patient is admitted in the ward, so you should ask about the day, date of the admission, and also the mode of the admission. Either he was admitted from the clinic or from the emergency. So then start with the presenting complaint. So like first thing is the time of onset. From when you are having this problem, like from when um, you are having difficulty in swallowing, so first thing is the time of onset. Then the mode of onset, either it started suddenly, or either it was it gradual in onset. So time of onset and the mode of onset. Then ask about the type of the food, like whether is he or she having difficulty in swallowing of the solids with liquids or saliva. So with this question, you will decide what is the grade of the dysphagia in this patient? So, type of food, solids, liquids, semi-solids, or either on saliva of the patient. It will help you in grading of the dysphagia. Then ask about the progression of the disease. Either is it progressive or is it intermittent? So ask about the progression. Then ask about the site of the food sticking, the site or point of the food sticking. Either in throat, upper chest, middle chest, or the lower chest. After this, you have to ask about some relevant question to the patient. No? Okay. Um, First, associated questions, associated symptoms. If the process is acute, so ask about the pain and fever. You have to elaborate the questions of the pain and fever in detail. I will discuss the questions regarding pain and fever in my later video. So you ask about the pain first, and then fever, vomiting, okay, vomiting, nausea, and bowel habits, and appetite, malaise. So you should ask about these questions in detail. Okay. Then come to the differentials. First, ask about the symptoms of the gastroesophageal reflux disease. So ask, like, do you have burning in the chest? Uh, Either ask about the burning in chest, water bash, altered taste, foul smell from mouth. This is also known as the halitosis. And point of food reflux. You may say site of the food reflux. So these are the questions you have to ask in the GERD.